Hello, and welcome to Facebook Live with Dr. Brie. I am just here today chatting with you about stress. As my 12 and a half year old likes to call it, people are very stressy lately. We've been noticing an uptick in that this year. And I used to say, about the parasympathetic, sympathetic nervous system balance that, the sympathetic nervous system is like running from a bear. It seems like 2025, the bear might be on fire for some people. There's been a lot of additional stress. So I wanted to talk a little bit today about how to understand stress from an objective measure called heart rate variability. Heart rate variability is near and dear to me because I heard about it when I was an undergrad at UC Berkeley, and then in med school, I was part of the American Holistic Medical Association. And one of my mentors, Dr. Lee Lipsenthal, who has passed, he was kind of on the ground floor of a company called Heart Math. And Heart Math was a company that's still around that really was the first to kind of publicize data around heart rate variability. So I want to speak a little bit to the work that they did because it was really pretty impressive and still today is a great tool. And now there are other companies, Whoop, Aura, Garmin, I think maybe even Fitbit, that are doing home monitoring devices that are kind of measuring and reporting your heart rate variability. So first and foremost, I want you to know I'm not here to promote any individual company. Like, I'm a family doctor and my patients are very proactive in Colorado. We use lots of tools for health and fitness, and there's a lot of people working on the longevity and biohacking side of things. And so I'm not promoting any one individual company or product. I happen to be a Whoop user, so I am familiar with that technology and how it has helped me with my insights. So I'll be chatting with you about that today. But this is just to give you some tools to understand how heart rate variability monitoring might fit in your day-to-day if chronic stress is something that you're up against, or if your stress levels are, hard to manage with other means. So back to Heart Math in the 90s, it was all about, of course, the 90s were all about preventing heart disease and decreasing risk for heart attack. And one of the big markers was noticing that heart attacks were increased on Monday mornings because people were at work and people were stressed at work. And there was this understanding that came out in the 90s around, the type A mentality and, was that a piece, was this stress piece, acute and chronic stress component, this hyperdrive, right? Was that a part of heart disease? And it turns out, yes, it is. And there was this company, Heart Math, that looked at how do we follow stress? Like, stress is so elusive, right? Like, I'm stressed, you're stressed, everybody's stressed, but what does that actually mean? And how do we track it, right? Like, I can't do a blood draw for stress. I can do all sorts of cool holistic and alternative testing around stress, cortisol, neurotransmitters. Those are all things that have come on the market since that time. But there still are some nuances there, right? We don't have a continuous glucose monitor for your stress response, right? Day-to-day fluctuations. So what heart rate variability is, it is a marker for how responsive your heart rate is to your parasympathetic and sympathetic nervous systems, okay? So you might say, okay, what's my heartbeat? And you might count it out, right? 6 seconds times 10, 60 seconds. This is what my heart rate is right now. But if you actually wear a device where you can monitor it, you'll see that heart rates actually change moment to moment. So you might be like 65, 67, 67, 68, 70, and that change. So, if we get a bunch of different points on a curve and we get that really close, you might see that your heartbeat does this, right? So it stays in a range, let's say 60 to 70, pretty normal resting heart rate, but it has this like fluctuation, right? And that fluctuation is heart rate variability. So it's the beat to beat variability. So 1 second, your heart is at 65, the next it's at 67, the next it's at 70, the next it's at 64, right? That is the heart rate beat to beat variability. And it turns out that that is influenced by the two arms of your nervous system, right? So we have our fight or flight nervous system. That's our run from a bear nervous system, your sympathetics, right? And that's the hyperdrive, get up and go, right? And that's helpful. Like stress is really helpful. That gives us our edge, that gives us our competitiveness, it gives, attention and focus and alertness. It, increases blood flow to certain areas, and, it helps you breathe faster and deeper, right? If you're running from a bear, you need all those pieces, right? So there's a role of the sympathetic nervous system, of course. And then we have our parasympathetic nervous system. That's our calm or downer nervous system. So rest and digest is what we think about, right? Restore, recover. That's our parasympathetics. So those two inputs are actually wired with your vagus nerve and various other nerves to the electrical activity of your heart. And they put those inputs in. So, speed up, calm down, speed up, calm down, speed up, calm down, right? So your heart rate variability is basically how sensitive your heart is to hearing those two channels, right? And so the more sensitive your heart is to hearing those two channels, the higher your heart rate variability will be. So H as in high is better, right? So a higher HRV is better than a lower one. It means your heart is more responsive, right? It has more resilience in there, right? Resilience is that funny word that we talk about for your wiggle room, right? The more wiggle room, the more, pliability and flexibility you have both mentally and emotionally and physically, like the better your health is. That's become very clear with all the biohacking and longevity lens, right? So heart rate variability is a marker for that. Where's my resilience level at? And so when we look at this, we can understand it from a moment-to-moment basis, and we can also understand it from a cardiovascular fitness lens. So Heart Math looked at moment-to-moment. So they actually have little monitors. You can put an ear monitor on or a finger monitor, and it would feed back how your heart rate variability was doing in a moment-to-moment basis. So you can actually do some deep breathing, and you can actually do belly breaths, right? And that tonifies the vagus nerve, moves your diaphragm. The different breathing techniques that have been used for this is 4-7-8 breathing, right? So inhale for 4, hold for 7, exhale for 8. Square breathing, inhale for 4, hold for 4, exhale for 4, hold for 4, right? Anything that brings mindfulness to that breathing activates your parasympathetic nervous system. And if you're on a heart rate monitor for your heart rate variability in real time, you'll be able to see it make a change. So what Heart Math did was they made a game out of it, of course. So for example, like the old school version was like a hot air balloon, right? And so you could make your hot air balloon move based on raising or lowering your heart rate variability. And so it was kind of a game. You could see how relaxed you could get to, get your heart rate variability to control this hot air balloon well. And I remember it distinctly because there was evidence that controlling your heart rate variability decreased your risk of a second heart attack, right? So if you found, man, I am type A, I had the heart attack at work and I don't want to have it again, and now I'm all stressed about having it, and what do I do? Introduce Heart Math. They did some studies. They said, hey, if you can actually bring down the sympathetic nervous system, and we'll show you how with our little game, then we'll show that you'll have decreased rate of a second heart attack. Great. So that was the game. And in 2006, I was rotating at South Denver Cardiology as a third-year medical student. And this is after being familiar with Heart Math. And they had rolled out Heart Math at the cardiovascular clinic at that time. And my attending was a cardiologist, longtime cardiologist. And I grew up, in California with parents who had meditated. I learned meditation when I was 7 years old, and it's just been a part of my upbringing. And so I have many different meditation practices I've used over the years. And so they put this monitor on me, and I can immediately control the hot air balloon. Like, I know how to manipulate it. And my attending's like, how do you do that? What's going on? How do you know how to hack this thing? And it turned out I just had a lot of practice. So meditation by itself can be very challenging for people who are new to it. But the beauty of biofeedback is it actually shows you if you're learning how to use the breathing techniques to calm your nervous system down. Because just like everything, meditation takes practice. You can't just be great at meditation the first time you try it. Like, it actually takes practice. So something like Heart Math, still out there, still a good option. We're actually going to be rolling it out here as a a way to kind of help you with your heart rate variability and stress response with Martina, our new nurse practitioner, because she has experience with heart math and we're both really passionate about it. So that will be something that's coming this year with Direct Osteopathic. But you can DIY it. You can introduce yourself to that company online and see what their products are and see if that's a tool that you want to use to manage your in real time biofeedback on your heart rate variability. So that's an option. But another option is to look at heart rate variability from the lens of cardiovascular fitness. And that's what a lot of the monitoring devices like Garmin, Whoop, and Oura do. They're looking at heart rate variability during slow wave sleep, typically. So at night, when you're sleeping, you have different stages of sleep, right? So you have light sleep, you have REM sleep, you have deep sleep, which is your slow wave sleep. And in that slow wave sleep segment, you don't have a lot of apnea or hypopnea or, issues with sleep apnea. And you have kind of this brief moment of just complete and total deep sound sleep, right? Where your thoughts of the day are not coming in like they can in light sleep or during the day when you're awake. So that has been a research marker for cardiovascular fitness and measuring heart rate variability, both internationally. There's been studies about that, and then in the US. So that's what a lot of the fitness companies use. And that heart rate variability also looks at chronic stress, but is a little more of a window into your cardiovascular resilience and fitness. So as you learn, what your normal is with a metric like that, you can understand how are the behaviors that I'm bringing into my life, like, meditation or using heart math, how is that influencing my day-to-day baseline on my heart rate variability? So that's been fun for me. I got this little device after I was recovering from the car accident that I was in with a concussion. And that's a really tough injury to recover from, especially as a physician. But, it's an injury you can't see, right? So I would notice that on days that I was more exhausted or more stressed or certain ways that I had slept or certain places in my cycle that I was more symptomatic of the concussion symptoms, like trouble finding words or trouble completing my sentence, staying on track with my thought process, those types of things, the brain fog that we hear, right? So when I was trying to understand what was influencing those factors, I decided to get a personal monitoring device. And that's been really, really helpful for me because I have a great ability to pay attention to other people, but not that great of ability of paying attention to how I'm doing. So it brought in a metric that I could see day to day, overnight, how is my stress response doing? And then I can make changes and I can see what influences that stress response using this metric of HRV, right? So a lot of people want to kind of be competitive about their monitoring with themselves or other people. It's really important to know that HRV and something is very individualized. If you get a monitoring device, you have to understand that your HRV is your HRV. Like, you want to know what your baseline is. You do not want to compare, like, oh, mine's 30 and his is 114. What's wrong with me, right? Women tend to have a naturally lower HRV. Endurance athletes have a naturally higher HRV. Again, higher is better, right? But it doesn't matter if me and my partner have different HRVs, 30 versus 60. What matters is if 30 is my baseline and I hit a stress, segment of life, right? The holidays, this was really great to see. All of a sudden my HRV went down because it was a stressful time for me. And then I could see, okay, I'm stressed right now. My resilience is down. How do I build that back up? So I got back into a meditation practice and I got myself on meditating every day again, consistently. And guess what? My January HRV was a step change back up again. And so I like to look at it really zoomed out like that. Like, how's my monthly HRV step change doing, and what are the things that I have changed? Have I focused on sleep? Have I focused on stress reduction? Have I focused on exercise? Those are all things that can benefit your stress and your HRV because it's an objective measure of that. The other things that can influence HRV are hydration. The more hydrated you are, the more stroke volume you have with your heart, the better your heart is doing. It's better for your whole body. And exercise is good for HRV generally as long as you're not overdoing it. And so a lot of the personal monitoring devices give you not only a stress response score like HRV, how are you doing stress wise, how restored are you, how recovered are you, but it also tells you how much strain are you putting your body under, how much are you pushing yourself, and are you actually balancing those two, right? Because oftentimes we think more is better, but sometimes more is relaxing and saying, today I need to actually like read a book or go outside and listen to the birds and not, go on a run, right? So those are ways that we can use monitoring to understand what our personal needs are. And so the last thing, of course, impacts heart rate variability is alcohol and sleep disturbances. Those are both bad, generally speaking, for your HRV. I know that WHOOP has done studies that, alcohol in one day will create an impact 4 days later on your HRV, so it will reduce it. That is one of the known influences. But then on a day-to-day basis, sleep is a big pain point for many people, and when their stress is up, their sleep is down. And so, if you are having symptoms with your sleep, the first place to focus is on how do I sleep better? How do I train my brain to sleep? And there are many things that could be a whole Facebook Live in and of itself, but not looking at your phone, not being on any device or computer before bed for at least a half an hour, if not an hour or longer. That makes a huge difference. Having a wind down routine, right? Like if you think about these pedals, sympathetic nervous system and parasympathetics, right? All day we're toggling on, do more, check emails, do the tasks, complete the things, right? But we're not often leaning into the relaxation station, right? So if you can figure out at that bedtime routine, how do I actually push on this lever, right? How do I calm it down? How do I turn the lights down and do some stretching, take a shower, do some journaling. If you have mindfulness routine, that's a great time to have it implemented because you'll see that reflected. If you're using an HRV monitor, you'll see it show up there. So those are some of my tips and tricks on managing stress right now. You certainly don't need to buy anything or get a monitor yourself, but if you're noticing that the things that you used to do to cope with stress are not working for you in 2025, you might want to get an objective way of figuring that out, whether you're using HeartMath or a different personal monitor. There are ways that you can kind of tune into those levers of your nervous system, and you can understand how to make a change. And that's what it's about, right? It's not about being perfect. It's about increasing your buffer and increasing your resilience. So if we can use HRV as a lens for understanding where that buffer is and how to support it as opposed to feeling bad about ourselves compared to another person, then we're ahead of the curve already and your resilience is already that much better. So feel free to put any questions and comments. And if you are a member of our practice, we do have a metrics review visit. It is part of our healthy living program. If you have a personal monitoring device, sometimes it's a little challenging to figure out what are the nuances that are influencing you and your individual physiology. So we can go over those metrics with you and help interpret influences or places that you can press on the levers to make a difference. So hope you have a great day.